My role with the clinical initiatives for the Delta Health Collaborative is to serve as the program manager over the community health workers, and so I work with healthcare systems around the Delta. Right now we have about 6 health centers that we're working with. They're federally qualified health centers, or FQHCs, or rural health centers, and then some private providers. These providers are charged with referring patients based on our eligibility criteria, where these patients have hypertension, diabetes, high cholesterol, and so we educate patients based on their risk factors surrounding the diseases they have or their conditions.
We were very excited. We have over 300 units of housing, which encompasses over almost 1,000 people. And our goal is to make sure that our residents have a healthy, safe place to live, but also that they are getting the education from knowing their blood pressure numbers to knowing where they stand physically as well. And we had community health workers that would go into the unit, into the complex monthly, and initiate programs from education to blood pressure monitoring to referring individuals who didn't have a physician to their physicians.
Okay, as we go through our month-to-month basis, each tenant meeting, we also talk about healthy eating habits, managing our chronic illnesses better, because we have several tenants here that are either suffering from diabetes or high blood pressure, and we always educate them on how to eat a little better.
My pressure was up a little at that time, and you know, I started back eating right after you get the training. You know, like I said, we know how to do these things, but we get off base. And when someone come and remind us, it's a good thing where you can start back where you were at one time, and you can, you know, get on a good path to do what's right concerning your health. Then you see that your pressure goes down.
I learned about different healthy foods you're supposed to eat and what not to eat, and just how to manage certain conditions that you may have, especially mine. Walking is pretty good, by which I'm kind of limited to a condition that I have as far as walking, but as far as eating is concerned, I'm not too good on that due to the situation around here. I can't get around to a store, you know, to get what I'm supposed to have.
Also, we've added an addition to their healthier eating by extending a garden outside of the apartment complex where they have fresh vegetables and fruits that they'll be able to have access to.
And taking the produce from that garden project and learning how to eat, learning how to cook, and learning how to preserve. So this helped our residents think a little bit differently about the food choices that they were making. And when we look at what we eat, it affects our health as well.
Yeah, free fresh fruits. Make sure you put some watermelon in there.
The role I play is, like I said, I'm a community health worker, so I'm out in the community. I'm out in the homes, checking on the patients, and just being informative, you know, using educational materials. You talk to them about how to better their health, how to manage their health, and for a better lifestyle overall. We have to use the health education material. We just cannot teach or interpret or counsel without the education material that we are supplied with, you know, because we're not licensed or certified to do that. But we can encourage, or, you know, to talk with a patient about COPD, or you know, the health risks of COPD, or, you know, the do's and don'ts, or are you taking your medication, or you skipping your medication. So we try to, you know, really, I would say, just lay down the health risks, you know, that it could cause other complications if you don't do this or don't do this. And most things I would like, you know, say to patient is also to follow the doctor's orders. So, you know, I touch bases with them on that. Or to see are they following the doctor's orders. And I would ask, you know, permission to see their medication bottles, to see are they taking their medications. And just by looking at the bottle, sometimes I can tell. So.
We offer screenings, blood pressures, blood sugars, cholesterols, BMI. Also, we offer continuing education with CPR training. We offer hygiene programs. We had just recently had a breast cancer awareness where we offer free breast exams. Well, we had a major program in February. Dr. Kenneth Hahn, the cardiologist, he came in and he spoke on heart disease. And he went into details, the signs and effects of heart disease. And also, after the program was over, we offered nutrition feeding behind it, and we offered free screens behind it for your blood pressure and your blood sugars and so forth.
Well, when our clients come in, we have material that we issue out to them and about ways to keep them from getting high blood pressure, or even if they have high blood pressure, ways of lowering their high blood pressure, teaching them to have a less salt intake and sodium, how to eat healthy and exercise and live a healthy lifestyle. And a lot of times you don't have to take the medicine. If you can catch it in time, you can change your lifestyle by exercising, dieting, and eating right. Our barbershop is like family oriented. Like most of my customers, they're like family. So when I talk to them, I say, well, I'm doing this for you. I want to make sure that you know that you're healthy. So it's never been a problem for me to talk to my customers and get them to do the blood pressure testing, nor fill out the paperwork or accept the paperwork. As I got a little deeper into the program, I started doing a little research and a little reading and, you know, looking up things. And as I took the blood pressures from different men that was coming into the barbershop, and it was, you know, my customer, people that I care about, they actually had, the numbers was high and they didn't even know it. So it's like a silent killer. So I've made them aware, and most of them, they went to the doctor and got medicine, and now their blood pressure is lowered, so they're back to a normal lifestyle.
So MACE's goal in this project is for us is to continue working with our residents, helping them to even learn more about healthy living, how to shop, and the garden project, which I'm so excited about and our residents love. It addresses those issues. In some of our communities, there is not access to healthy foods, or if the access is there, the quality is poor, and then the price is high. So we're going to continue our community gardens. We're going to continue our education efforts. We're going to continue to go in and do cooking projects with our residents. And the wonderful thing about it is that our residents are taking over. So it's like the analogy, you know, if you teach a man to fish, he'll live for a lifetime. So, and we're not giving the fish, we're teaching our residents how to, so that they can take these skills and live for a lifetime.
It's such a great asset, and you don't have to have a big congregation to do it. You can have a small congregation. Every little step is a help. So I encourage small churches, big churches, even social groups, get involved and, you know, help the healthcare be better in the community.
So when we look at diabetes and we talk to patients in the communities, they see diabetes as the giant. They see hypertension as the giant, high cholesterol as the giant. The giant, so to speak, is something too big that they can't handle, that they can't touch. And so we charged our community health workers and myself and other nurses and community health educators within our systems to go in and talk to these patients and to the communities, let them know giants can fall. and that they can be defeated. And so with education, with proper management, through healthcare systems, with just empowering the patients that they can defeat these giants.